To all of you who have been reaching out asking so many questions about your cardiovascular health based on the most recent newsletter that I sent out, where I was explaining that cholesterol is just not the best indicator of heart disease, and that there are other markers that would be way more indicative of true plaque representation in the arteries. So I want to show you a quick case today, and this just happened recently, as it happens so many times in my practice, where I have a patient who comes in and the cholesterol markers look amazing. The total cholesterol on this patient is 116, triglycerides are 59, their HDLs are 67, and their LDL cholesterol is 36. So based on those numbers, he is told that everything is fine, there's nothing to worry about, right? Obviously his numbers look great. So when I started working with him, there were certain things that he was saying to me that I felt needed further evaluation. And then of course I ran the deeper markers. And as I explained in my newsletter, some of those deeper markers are things like apolipoproteins, lipoprotein A, lipoprotein PLA2. You want to look at the pattern and the peak size of the LDL cholesterol. You want to look at a CRP level. So when we started to look at more of those in-depth markers, there were some things that started to look a little bit like red flags. And so I said to him, let's go ahead and do the cardiac calcium score, which I also spoke about. So the calcium cardiac score is a very non-invasive way. It's a CT scan that you can look at the arteries that supply the actual heart. And so we have about 5 main portions of the arterial system that supply the actual heart muscle. And the main one is called the LAD, which is the left anterior descending. Also, unfortunately known as the widowmaker, because it does supply a bigger portion of the heart muscle. And so this cardiac calcium score will take slices and small pictures of the arteries, and we can actually see if there's plaque in those vessels. And it's such a great way to have this evaluation if we have any doubts or concerns, or there's a strong family history of heart disease. And so what happened is, this gentleman, who I will say to you is now 59 years, male, as I just said. And so he went ahead and had the test done. And let me show you a picture of those results. So those results say that in findings, the coronary artery calcification scores, it says left main is a score of 1. His left anterior descending, the LAD, is 337. His right coronary is 125. And so his total score came back at 463. And based on the recommendations and the statistics that are involved with someone of his age and a number like that, okay? So it says here that a score over 400 is a significant plaque burden, and it indicates increased likelihood of significant coronary stenosis, which basically just means that the plaque is blocking these arteries, okay? So the risk of a future coronary event within the next 5 years is high. So when I see something like this, something that could have so easily been missed based on a lipid profile that looked normal, because cholesterol and HDLs and LDLs and triglycerides were the only thing being looked at. Now, I'm not saying that there isn't value to those numbers. I'm just saying that there's more that needs to be evaluated and understood so that we can truly treat appropriately heart disease. So I hope that this helps you today. And of course, reach out to us. Let's run the right labs. Let's get your calcium score done. And then certainly move to the part where we talk about how can we actually clean this plaque up and do it as naturally as possible. Have a blessed day. Hope this helps.